Thank you for your introduction. So today my topic is on the maintenance treatment of adenomyosis after HIFU, as well as adjuvant therapy. I am from the Department of the Obstetrics and Gynecology of Zhongshan University Hospital and the Director of the Gynecology Department. In treating the HIFU, I take the lead in Taiwan. My ability and capacity have been recognized by experts in Taiwan, so I'd like to share with you my experiences. So, CSMUH Zhongshan Medical Hospital has launched HIFU treatment in 2014, ranking the second or third in Taiwan. And we have also encouraged more than 20 hospitals in Taiwan to initiating or launching HIFU treatments. Adenomyosis refers to the tissues in endometriums diffused into other tissue. It is including diffuse and focal. And its manifestation include the menorrhagia or dysmenorrhea. And the incidence is 41 to 45 years. 10% to 40% of uterine specimens in anatomy. So it's a prevalent disease in women, with the decreasing of the world fertility. 35 years old to 40 years old women start to have the requirement for fertility. So this is consistent with today's topic. In treating this kind of disease, hysterectomy is relatively a good modality. Is there any alternative treatment for adenomyosis except for surgery? A medication may be a choice, including injection and oral medication. Medication includes antagonist, or uterus-sparing resections, pregnancy rupture rates 4%. In Zhongshan, in our hospital, we prefer to use HIFU treatment so as to preserve the fertility. In Taiwan, adenomyosis is a major indication for HIFU in the future. In HIFU, we do not have medical insurance, so in treating the adenomyosis, there is no better choice for the patient except for hysterectomy, so they will choose HIFU treatment. In recent years, there are a lot of research in this regard. In 2015, 80% of the patient at 3 months, 1 year, or 2 years, there is a relief rate for the patients. There are 4 papers regarding this aspect, indicating the 80% of relief rates of HIFU treatment in treating the adenomyosis. That inspires me and provides me a lot of information. Adenomyosis or other gynecological disease. This is a major problem about recurrence of the disease. Even if you resect all the lesions, there will be a high rate of recurrence and the possibility for the second surgery. So if the patient wants to preserve the fertility, we should avoid impairing the endometrium. So even if we remove the uterus and ovary, 8% of the patient requires a second surgery. Even and looks very young, but I graduated from school 20 years ago. So I see a lot of patients having more than 3 times of surgery. So HIFU treatment is confronted with the same problems of recurrence. So we should avoid the recurrence. What should we do? In 2020, in endometriosis, we should prescribe some post-operative medication for the secondary prevention. So what should we do for HIFU after the HIFU treatment? Gastrin, ISMINIM, oral antagonist. These are good adjuvant therapy for adenomyosis after HIFU, so as to ameliorate pain, avoid hypoestrogenic state, restore fertility, suitable for prolonged use, and improve the quality of life. So after selection, we only have 4 choices, including Vicini, Gastrin, Merino, and oral GH antagonist. But the fees for the oral GH antagonist is very high, beyond the affordability of many patients. So the first 3 are good choice for affordable choice for patients. And GH does not help in short term and long term. Merino is better. This is a research in 2022. So the efficacy comparison between Merino and the LNGIUS, and we find it's a good choice. So we think that Merino is a good choice for the HIFU treatment as an adjuvant therapy. The mechanisms behind the adenomyosis after treatment, it will not induce the bone decalcification. In safety, efficacy, and all the aspects, it has good performance. It has some maybe negative effects. So we are working out some solutions to reduce the side effects. We will prescribe 6 months of the treatment, and then we provide the adenomyosis. Only in GNR, there will be a recurrence rate after 3 months. This is my protocol. That 3 months after the treatment, and the patient will embrace pregnancy. In 2016, my treatment is no immediate medication, but I find that there is a recurrence of the disease after treatment. So I suspect I should provide more medications or suitable medications. I I thought I should provide favorable solutions or modality for our patients. So in 2020, we provide immediate adjuvant treatment. And in my patient, 19 patients, only 4 patients need hysterectomy. And we think that we should provide adjuvant therapy for the treatment of the adenomyosis. But what's the timing? What's the solution? I think there should be a multi-center, nationwide study in this aspect. Thank you. This is my sharing. Thank you.